Welcome to our channel. Today, we're going to talk about cesarean section or C-section surgery. This is one of the most common surgical procedures performed worldwide to deliver a baby. We'll discuss what a C-section is, why it's done, how the procedure works, recovery tips, and risks associated with it. If you find this information useful, don't forget to like, share, and subscribe to our channel for more health-related content. Let's get started. A C-section, short for cesarean section, is a surgical procedure used to deliver a baby through an incision made in the mother's abdomen and uterus. It's typically performed when a vaginal delivery isn't possible or safe for the mother or baby. It can be a planned procedure or done as an emergency surgery during labor if complications arise. According to medical statistics, around 20–30% of births globally are delivered via C-section. Let's now explore why a C-section might be necessary. There are several medical reasons why a C-section may be recommended. Medical emergencies, fetal distress, where the baby's heart rate drops or shows signs of stress. Umbilical cord issues, like a prolapsed cord. Position of the baby. If the baby is in a breech or transverse position, making vaginal delivery risky. Multiple pregnancies. If you're having twins, triplets, or more, a C-section is often safer. Previous C-section. Women with a history of C-section may need another, depending on the scar's condition. Placenta issues. Conditions like placenta previa, where the placenta covers the cervix, or placental abruption. Health conditions, high blood pressure, preeclampsia, or diabetes in the mother. These situations can make a C-section the safest option for both the mother and baby. Now let's understand how a C-section is performed. Preparation. The mother is given spinal or epidural anesthesia to numb the lower part of her body. This ensures she's awake and alert but feels no pain during the surgery. Incision. The surgeon makes a horizontal incision, usually just above the pubic area, also known as the bikini cut. Delivery of the baby. After the uterus is opened, the baby is gently lifted out. This part typically takes only a few minutes. After delivery, the umbilical cord is cut and the baby is handed to a nurse or pediatrician for evaluation. Closing the incision. The surgeon stitches or staples the uterus and abdominal layers. This step takes the longest, around 30 to 45 minutes. Throughout the process, medical staff monitor the mother and baby's vitals closely. By the way, if you're finding this video helpful, don't forget to like and subscribe for more such informative content. Recovery after a C-section is a bit different from vaginal delivery and usually takes longer. Here are some key points. Hospital stay. Most mothers stay in the hospital for 3 to 5 days post-surgery for monitoring. Pain management. Painkillers are prescribed to manage post-surgical discomfort. Care for the incision. Keep the incision clean and dry to prevent infections. Your doctor will guide you on how to care for it properly. Activity limitations. Avoid heavy lifting, strenuous activities, or driving for at least 6 weeks. Breastfeeding tips. Certain positions, like the football hold, can make breastfeeding more comfortable during recovery. Emotional recovery. Hormonal changes, combined with physical recovery, can sometimes lead to emotional challenges like baby blues or postpartum depression. Seek help if needed. Remember, every woman's recovery process is different, so always follow your doctor's advice. Like any surgery, C-sections come with risks. Here are some potential complications. Infection. At the incision site or inside the uterus. Excessive blood loss. Although rare, some women may require a blood transfusion. Adhesions. Internal scar tissue that can cause discomfort later. Breathing issues in babies. Babies born via C-section may have temporary breathing difficulties. Future pregnancy risks. A C-section may slightly increase the risk of complications in future pregnancies, such as uterine rupture. While these risks sound scary, remember that medical teams are highly skilled at minimizing them. In conclusion, a C-section is a life-saving procedure that ensures the safety of both mother and baby in high-risk situations. If you're expecting and have concerns about delivery, talk openly with your doctor about your options. And that's a wrap for today's video. If you found this information useful, please like, share, and subscribe to our channel. Your support helps us create more valuable content like this. Thanks for watching, and take care.